So, good afternoon. I'm Michelle Beisker, Vice President of the Eastern Iowa Health Center Board of Directors. I have to tell you, this is my first floss cutting event, so welcome. We're glad you're here to join us today. On behalf of the Board of Directors, thank you for joining us for today's celebration. I would like to extend a special thanks to our elected officials in attendance, including Mayor Ron Corbett, Council Members Scott Overland, Pat Shea, Scott Olson, Justin Shields, County Supervisor Stacy Walker, State Senator Liz Mathis, Rob Hogue, and State Representatives Liz Bennett and Art Stade. Thank you for joining us this afternoon. So today is obviously a big day for this neighborhood and the community of Cedar Rapids. For far too long, there have been very few places that the most vulnerable members of our community could go for dental care, often left to decide between putting food on the table and fixing a toothache. The tooth, as you know, would go untreated. Eastern Iowa Dental Center hopes to change this reality. Lois was one of those people. At 67, she was living on a fixed income and had fought a battle with cancer, and she won. Unfortunately, the chemo and radiation took a large toll on her body and on her teeth. With limited income and no dental insurance, it had been years since she had visited the dentist. Our dental team was able to help Lois sign up for a voucher and to cover the cost of her care. She began to cry tears of joy when she knew she would finally get the dental treatment she so desperately needed. Another patient, Jenny, came to us with visible decay on her two front teeth. She didn't know where to go before we opened our doors. We were able to fix her teeth, much to Jenny's delight. She said, "I can smile again. I haven't been able to do that in over a year." Lois and Jenny are just two of hundreds of patients that we have been able to care for in just our first few weeks of operation. I personally cannot wait to see what other great work our dental team is able to provide to our community. Someone who has seen firsthand the needs of our most vulnerable in our community is Senator Liz Mathis. Senator Mathis is ranking member of the Human Resources Committee. She also serves on the Appropriations, Commerce, Education, Health Policy, Oversight, and Child Welfare Advisory Committees. As we know, she's one busy lady. Please join me in welcoming Senator Liz Mathis.
Thanks, Michelle. It's great to see all of you this afternoon. Thank you so much for inviting me to speak today. Thanks, Joe. Joe and I go way back, good friend, and I'm so glad he's here, and he is really helping out this community by doing this, and especially locating the clinic here in Wellington Heights. It's just so smart to do this, so accessible, and we're just as proud as we can be that you're here. It's amazing to hear the stories that Michelle talked about. And it's astounding to me, and it should be to you, that there is immense disparity in dental care for the most needy in our community. People of all ages with low incomes have a significantly higher number of dental care issues and health issues. And dentists can and do find serious medical issues for many people looking at their teeth and at their gums. Serving as the ranking member of Human Resources Policy for the State Senate and listening to constituents, I've heard many stories just like Lois and Jenny's. Medicare and Medicaid recipients with unending pain who need dental education have difficulty finding a dentist and getting transportation and paying for the care. It's good that we're right on the bus line. In my district, several dentists have stopped taking Medicaid patients or have stopped offering those services because the reimbursement is so low and the need is so high. That means that people have less access to care. We also see people who have been unable to secure a job because bad dental health or bad teeth can translate into poor employment prospects. It doesn't have to be, and it should not be like that. As a state senator, I'll do my part to support this much-needed mission at Eastern Iowa Dental Health Center. and hope that we start to shift the tide, at least in our community. And Joe, you and your team are doing phenomenal work and are such a wonderful asset to this community. Thank you for asking me to come, and congratulations on a job well done.
Thank you so much, Liz. We appreciate your service to our community and the state of Iowa. So many in our community and beyond have made the Eastern Iowa Dental Center a reality. Of the $1 million renovation, over $800,000 came from grants, donations, and gifts in kind. In Cedar Rapids, the great debt of gratitude our community has to the seemingly endless philanthropy of the Perrine Foundation, including a generous grant to enable the purchase of the building and the land for this dental center, and the land next to our parking lot for future expansion. Next, I would like to welcome Jack Evans, President of the Perrine Foundation.
Well, I too want to thank the management here for the invitation to come. I'd like to make a comment and then an observation. The comment would be that I think many of you in this gathering know that the mission of the Perrine Foundation is to improve the quality of life in Lynn County. And I think if you just take a stroll through this facility, you can imagine in your mind how many people's quality of life is going to be improved. So we were pleased to be asked for a grant and proud to be on the team. And I want to follow up on what Jeff said about collaboration. And that comes in the term of an observation. We see a lot of grantees. And I think Joe and Doug and Michelle and the board did an incredible job pulling together a plan of finance that would make this come to fruition. And come to fruition here, because I know nothing about medical practice, but Darlene Schmidt taught me that you're going to see people that not only need to be here, but they need to be there because they're ill and they're sick. So my word today is to congratulate you, Joe, and the rest of your team. I think this will be an organization that will live and thrive long into the future. Congratulations.
Thank you, Jack. And thank you to the board members of the Perrine Foundation for your continuous philanthropy and your support throughout our community. Now I'd like to introduce Joe Locke. He has been the guiding force behind the growth of an Eastern Iowa Health Center since 2015. I can do that math, and that's only a couple years. Pretty impressive, Joe. I have to say the board is very proud of you and your staff. Since Joe joined us, we have grown from a single health center to 3 and soon 4 facilities. Stay tuned for more information on our next endeavor coming in the very near future. Joe has brought vision and hopes for the future into reality. Please join me in welcoming our President and CEO, Joe Locke.
Thanks, Michelle. You and the other members of the board have played a significant role in making today a reality. Could I please ask our board members in attendance today to raise their hand and be recognized? Thank you so much. And with the support of the board of directors, Wayne and his team have spent countless hours here donating all of their time to all of the electrical work in this facility. And Wayne, I hope that I have half of your energy when I am your age. So thank you very much to Wayne and his team. So, in a word, today for me is astounding. To see this dental center come together has really been remarkable. It's fitting that this building was once home to the life insurance office of Cleo Edwards. Cleo passed in 2014, but not before leaving a legacy of service in the Cedar Rapids community. I haven't seen Charisse, but I hear that she's here. I just wanted to recognize his daughter, as how she fondly talks about how her dad served on many local nonprofit boards and always made sure to give back to the community. I hope that he would be proud of what we've done with his former office. Our staff strives to meet each of our patients where they are and where their needs are. So something that sets us apart is we offer outreach to the homeless, language interpretation services, social work, health coaching, all within the walls of our health centers. Through our status as a federally qualified health center, we're able to extend lower cost to our patients and help connect them to the additional services in the community that they want and need and deserve. All this means that our patients get the care they need when they need it. Our patients don't have to wait for months on end while they struggle to save money to cover the cost of their care, because we're here for them. So before we cut the floss, as we say, and go inside to see the new dental center, I'd like to thank my incredible new staff for their patience, flexibility, and dedication to service. I want to just call out our dental team, who are all here today, including Dr. Stephanie Cooper and Dr. Diana Jones, Office Manager Jill O'Hara, Front Office Manager Courtney Hendricks, Dental Hygienist Angie Weiland, Lisa Lopez, and Heather Wilhelmi, and Dental Assistants Lonnie Burton-Luckman, Brittany Kiersman, Candace Pope, and Kyle Letterly. I love our Eastern Iowa dental team. Ladies, raise your hands so people can see where you are. Thank you so much. We are fortunate to have found the best of the best. So here is something I'm going to ask you to do. If you have dental insurance and you want to help those that are less fortunate, please consider making Eastern Iowa Dental Center your new dental home. My commercial dental insurance helped to offset the cost of those who can't afford to pay. Now, the reason we're all here today, I would like to invite the members of the Delta Dental of Iowa Foundation and Cedar Rapids Metro Economic Alliance and our elected representatives, as well as the EIDC staff, to come up and help cut some floss.
Your mom will be proud. Okay, red coats, come on in. With the sunglasses, go ahead.
Okay, thank you.